So the ELOQUENT-2 is a randomized phase 3 trial trying to evaluate the benefit of elotuzumab in combination with lenalidomide and dexamethasone versus lenalidomide and dexamethasone. And it's really based on early phase 1 and phase 2 studies that we did at our center as well that demonstrated that elotuzumab and lenalidomide are synergistic when given together. Better overall response rate and longer progression-free survival. What we showed at this was that in terms of the baseline patients, there were over 300 patients randomized to each arm, that a significant fraction of patients, roughly a third, had high-risk disease at the time of initial presentation. Roughly a third were refractory to their last line of therapy, even though it was an early treatment cohort. And we demonstrated a 30% improvement in duration of remission, progression-free survival, an improvement in overall response rate, and suggestions that there were improvements in overall survival. It's too soon to have that formally analyzed, but certainly if you look at the absolute number of deaths, it favors the group that got elotuzumab. This was the first phase 3 trial reported with elotuzumab, and there is a second phase 3 trial that has completed enrollment called ELOQUENT-1, which treated newly diagnosed myeloma patients with either Elo-Len-Dex or Len-Dex. We're waiting for follow-up on that study. There are trials adding elotuzumab to newly diagnosed in the transplant-eligible setting, combining with RVD, and then other trials looking at it in the relapsed refractory setting with pomalidomide and bortezomib as well.